Hello, good evening, and how are you doing? Welcome to another session of Ask the Doctors. Now, this program holds every Sunday by 8. Okay, I have to do this. Sorry, guys. Welcome to another session. Okay, this. Let me do it here. Okay, let's see. I have to do something here. Let me mute this volume here. Mm. Hi, good evening, everybody. Can you hear me? If you can hear me, say yes, I can hear you. Say yes, I can hear you. So yeah, tell me. If you can hear me, just say yes, I can hear you. Let's go. Ladies and gentlemen. Okay. I'm live on Facebook, I'm live on YouTube, and I'm live on Instagram. Yes. Just say yes, I can hear you. Good evening, everybody. Yeah, okay, you can hear me. Yeah, good. I see you. Yes, I can hear you. Elizabeth, how you doing? Okay. Yeah, so how are you? How you doing? Good evening. Yes, I can hear you. Yes, I can hear you. I see you. I see you. Very good. Okay. Good evening. Yes. Ijoma, how you doing? Okay, those on Instagram can hear me. I can see. Nice one. Now we are talking about the benefits of annual screening. How you be? Okay. I'm trying to do something here. This this stuff, it do me somehow. I dey come. The Instagram is giving me a feedback. I can see you on Instagram. Yeah, watching. How you day? Good evening, Eunice. Eunice, I see you. Eunice, I see you. Okay. Okay, I'm Mojis. Yes, welcome. So where are you joining me from? Talk to me. Where are you joining me from? I need to know. Benefit of what? Look at it on the screen now. Hey, my God. Benefit of screening is on your screen. So we're talking about the benefit of annual medical screening. But before we start, I want you to tell me where are you watching me from? Remember, I am live on YouTube. I am live on Facebook. I'm also live on Instagram at the same time. Yes. Jenny, good evening. How are you doing? Dr. Israel, Dr. Israel, I can't see you. Share the diverse. Yeah. Eunice, how you doing? Okay, Dr. Israel is live. Dr. Israel, so if you can hear me and you're ready to join, just do me like this. Remove your glasses. That's in the reflect. Yeah, I'm bringing you up. It they reflect. Your glass, they reflect on the screen. Yes, it's better that way. Mhm. Okay.
That's for my iPhone.
Dr. Israel, good evening. How you doing?
Good evening. How we did today?
You did very fine. Oh, why you dey spoil face like that?
I don't fit without the glass. I don't fit.
Okay.
They lie to
Okay, without the
they
glass,
lie
no
to me too
problem. No
much in my
problem. No problem. No problem. Okay, so okay, Israel. Before we start, we did live on Instagram at the same time right now. You understand? Mm-hmm. Yeah. Okay, so we dey talk about the benefits of annual medical screening. So make I hand over the floor, Dr. Israel. Dr. Israel, take over.
Okay. Good evening, everybody. Today we decided say we'll talk something not be to con not be every time we dey talk about one particular disease or one particular thing. So today we want to talk. This one is just like a general talk, a general talk. So we call it annual medical checkup. So when we talk about annual medical checkup, annual medical screening. So the first thing we want to know for there now, what it be annual, what it be medical screening. So when we don't put the meaning to these things, then we will come know why it good make we dey do this annual medical screening and wetin be the benefit, wetin we go gain when we take do this annual medical screening. So annual mean yearly, annual mean yearly. That is at least one every year. At least every year you dey do test. E no mean say you dey do screening. E no mean say you must dey sick. E no mean say something must dey do you or do everybody for the house before you go do am. Wetin e mean is that every year you just carry yourself go hospital, make dem run some screening for you based on your age.
What happened? Dr. Israel, don't lose we don't lose Dr. Israel now. I don't know wetin happened. Welcome. So Dr. Israel, they talk about annual medical screening, wetin we dey do yearly. But for some people, they go see say annual medical screening be like they waste money. Why should I be screening myself? Now, make I tell you one story. I know people where they watch me now, where they say they go get car, and as they get car, they always service their car. They will say, okay, every 3 months, um, I won't I won't go service my car, or every 3 months or every 6 months, I won't go service my engine because they notice the engine or the car, now they give them money. When you ask them, you don't go for medical screening, you go screen your body, they will say for waiting. Why? Not knowing that the body now even be much more important than even that car or that engine where they go screen. Do you understand? Oh, so much more important. Now, annual medical screening for those they developed world, e no dey expensive for them. For those wey dey developed world, sometimes or even most times, na insurance dey cover them for those annual medical screening. They dey do am, and they even remind them. For those wey dey developing nation, annual medical screening be like big deal for them. E be like, hey, if you wan do annual medical screening right now, my pocket, bless I go spend money. Or they no even know say you can have basic test, basic medical screening wey go help your body, wey go pick some kind small sickness before e even big and cause you problem. So the Israel is back. Make I bring Dr. Israel Black back to the platform. May he continue where he stopped.
Okay,
Dr.
sorry
Israel,
for
welcome
that
back.
breaking transmission. Thank you. Sorry for the breaking transmission. And I believe say Dr. Fred already tried to explain what the annual medical screening be. But I'll just throw small thing based on as I be the talk, what I prefer the talk. So it not mean say you must be sick, it not mean say anything go to do you before you go for this annual checkup. Then because it's a norm, that mean that they call it screening. So and also I believe say that because of how the situation for our country, Nigeria be, when we say that out of pocket now we dey do everything we concern health, that make it a day a little bit difficult. Outside Nigeria, outside the country, in the Western world, when we say most of the health things we dey do, And if once you get their NHIS or so, you are able to get all this screening done. And yes, you they pay, but they pay small with style. So you get all this screening done, and then they always put on it be like a routine thing for them. They go tell you where you need to come for your next routine screening test. So now, so all those ones they do their own, and I think it don't reach time when we even in Nigeria should have something like that where we go feel put in place. Say when the people come for screening, we can actually tell them to come so time for a continuous screening. Now, when we say medical screening, medical when we say medical screening simply mean doing some investigation or going through question and answer when the doctor go ask you, um, not to get a diagnosis, but to find out something, to find out whether you get any problem or not. So screening is not like treatment. No, screening is just to find that. Is to find out. That's may I use that? That and the simple method word when I'll feel use. Then to find out something about person, whether it they good or bad. So that if it they bad, we will quickly know what to do. But if it they good, we will also quickly know what to do. So that's what this screening be. So when we now talk annual medical screening, it means say person they come do this screening, come check himself at least every year. But as I earlier said, there are some disease states or some condition when we say you don't need to wait for every year. There are some condition when we say now every 2 years now you they do the screening. So it now depend on the condition when person they look into. And not be everything that they screen. Most of the disease where they screen are mostly chronic diseases. Those things where if give you chronic diseases. Now, when we do hypertension, BP, those one are still screening because we know they go find you whether you get BP, but we just check. So when we do anything like may we just check this person they fine, but may we just check this particular thing. And those are the annual screening. So when we don't check anything what we see, we go feel use and talk or an act concerning that person. Dr.
Dr. Israel, what's happen? Okay. Dr. Israel, network. Don't sneeze. Okay. If you know, say you just they come, you they welcome. We they talk about annual medical screening, and we did live on Facebook, we did live on YouTube, we also did live on Instagram. I beg share this video, so that make your people, make them see, ask questions, make their con learn. Now we get different types of medical screening. Somebody tell us for here, law. Ugochi is I go for medical screening every January. Very nice. Now, some people never do medical screening at all for their life. And one day you could just hear say, this person say he get kidney problem, this person say he get cancer, this person then say he get diabetes. But he no check, he no pick am early. So everybody wey dey lis ten to me, whether you dey watch it for Facebook, YouTube, or Instagram, tell me when be the last time wey you do medical screening. Now we get different types of medical screening. We get the ones where go cover everybody. Dr. Israel don't tell us sometimes why we need to do medical screening. You understand? So we get the one where we say cover both people, man and woman. We get the one which is very specific for man. We get the one which is very specific for woman. If you know you don't do medical screening before for your life, tell me which one you do, when you do one, where you do one. That's for Instagram. Tell me, I can see you when you do medical screening, which medical screening you do. Put them in the comment section. Um, okay, so Dr. Israel, welcome back. Make I bring Dr. Israel back to the platform. Sorry, Joe, and again feedback. That is why I can remove my earpiece. Okay, let me bring him back. Okay, okay, Israel, welcome
Okay,
back.
sorry. Okay, thank you. So I actually want to leave the stage for you to say one or two things. Um, Based on after I don't talk always I talk. So I believe say you don't talk one or two things. So when would they talk about screening? It not mean say you need to use all the money when you get. Let me go to Nigeria situation. It not mean say you need to use all the money when you get to do screening, because there are small things when you fit do as screening. I remember I say checking of your BP. They are part of screening. We they call them vital signs. All those vital signs you check, they are part of screening, because they fit even tell us something that is going on inside your body, and those one fit lead us to do other investigation or other tests to find out if there's other things. So but that one, those checking of BP don't need to be done once a year. No, but I just use that one as a case study because they are still part of uh, doing screening. So doing your blood work once in a year, it's not bad. You check your food blood count, your sugar level, your kidney test, liver test, cholesterol, that's fatty liver, and sorry, not fatty liver, fasting lipid, and all that. For the men, when you don dey pass 40 years, you come dey do your PSA. For women, you dey do pap smear. I know pap smear is done once in every 2 years though. Pap smear, and just like that, you dey do all these tests at least once a year. E mean say you dey do screening. E no, as I like say, no be say you dey sick, but you just wan do am to know how fit you are. So as we dey grow old, we suppose to dey do dis test to know how fit we are, because e dey very important. So wetin be the importance of doing this um annual medical screening? What's the importance? So one of the importance of it na it dey lead to early detection of disease and diagnosis, early detection and treatment of disease state. So e get some disease wey be say if you quick know say you get am, it can be treated. We go fit handle am well and on time. And because when we handle them on time, we go fit cure them. But if you not dey do this, and most of these disease are still things that will not show themselves. They will not tell you say problem dey until they don dey in a chronic condition wey be say you go need
Hmm. Israel, your network. Hey, my God. Okay. So somebody tell me here, say, for my house, we get saved for hospital bills. If we no sick throughout the year, January, we got the money, go do screening. Yes. So, ladies and gentlemen, now make we talk briefly as Dr. Israel they tell us say the type of screening where we get. As a man, if you be man, you need to do your screening. If you be woman, you need to do your screening. Number one, your blood pressure. You check your BP. The next one again will tell you check your cholesterol. Dr. Israel talk you check your lipid. Hmm? You check your fasting lipid. You check this. And then as you dey check this one, sometimes we fit even go further. We go check kidneys. We go further. We go do blood count. Now the thing wey we don notice be say for this part of the world, a lot of people dey get kidney problem small, they no go know. Some people dey even get sugar problem, they no go know. Diabetes go dey inside their body, go dey disturb them, go dey spoil the body small. Then one day e go just show face. Then now for women, we go tell women say make your breast screening, your breast cancer screening, your mammogram. You understand? We go tell women make them do their pap smear screening. We go tell women make them check themselves. Sometimes ovarian cancer. If you get person for family, we don't get any of this problem before. You go check. Then for man, prostate cancer, it is very important. Make you check. And then if you don't get person for your family, we don't come get colon cancer or colorectal cancer. It go dey very important. Make you also screen yourself because if you know dey screen yourself, one day, this problem fit just come up, spoil the body. They hear me so. Now at the end we talk say it's quite expensive. I cannot afford it. But sometimes if you save money, just like with law or the talk now, when you save your money from January, February, March, April, you keep small money, small. So at the end of the year like this, you will just use that money to screen your body. When you gather the money, go screen yourself, you are investing in yourself. A lot of people, I want to buy house. I want like I want travel. But you don't know, say that body where they do all this waka, body self fit dey sick. So one way to invest in yourself na to go for medical screening. You dey hear me so? If you know say you don't understand what we dey talk, put am for the comment section. Make we go see if you dey follow us. Oya. Put am. Swale. Hey, I greet you, sir. Instagram. Dr. Gabriel, welcome back. Oh, boss, I salute you.
Thank you. Sorry, I
Dr.
just
Israel.
guess my network the
Yeah.
trip off by itself. Yeah.
Okay. Okay. So now may we talk about some
Okay.
of the benefits of medical screening.
Okay. And some of the benefits for medical screening, I would say, when you test yourself, it can be a baseline to know if there's anything for anything wrong with you. When we talk that one, we talk say it be say you could feel be saying that one of the things where you feel quickly detect if you get any health issue or not. So that if you get any health issue, quickly we go quick take care of them. Because we know say most of these health issues they feel not get signs and symptoms. And because they not get signs and symptoms, sometimes most people they can't find that when the thing don't affect them well. That's one of the benefits. Another of the benefit I be say when you want travel, sometimes you need all these things, all this medical checkup as a guide to take pass one point or the other, and then it come say you will need to do some immunization and all that. And before you take some vaccine self, you need to do some tests. One na hepatitis. Hepatitis test can just be a screening test for you as well. So if you can see say you not dey positive to hepatitis B, you can actually take the vaccine. So it will make you know when to take vaccine and what to do. Okay, I think those are the two benefits I feel remember. Also, another one is that it will still help us know how to reduce our. It will also help us to save our finance. It will also help us to save our finance. What I mean be say, if you could know of something, and the money when you go take treat that thing go small pass when you not quit know of the thing. So it will help us manage our finance as well. And apart from our finance, every other of our resources, even human resources, it will also help us manage them. Because when they know something on time, you may not need admission. It will be something when you go, you need to work out, enter the place and they treat you and you come out. But when you know late, that one fit come affect both your social activity, your and psychological activity and otherwise. So these are some of the few benefits when I think say I feel remember. I don't know if Dr. Fred gets one or two to add join.
Yes. Okay. Dr. Israel, if we get one comment for Instagram. So Swale Baba one say, Doctor, people they fear to go for medical checkup because now then person will see say good things they inside the body. So what do you want tell people where they fear now? Say, if I go do medical test to and they go see problem for my body. So I beg, I don't want to go do test. What you go tell the person?
It better make the make you do test say they see problem for your body and they can't treat am for you than to say you not do test, the problem can't do your body, they cause an other problem for you. It is better say they quickly see am, because if problem don too many for person body, mostly for human being, e fit lead to their death. And okay, let me use cervical cancer as a case study. If woman get cervical cancer, e dey start from deterioration of the epithelial cells, the cells, and the cells go first dey spoil small 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 small. Those are na be the reason why pap smear dey very good. If this woman decide say e no go do pap smear because im dey fear say e go see wahala, you remember the small change of that epithelial lining na something wey dem go fit treat, dem go fit help quick remove am and everything go dey good. Now this person decide not to go for screening because e dey fear or because e no wan see wahala, then e come go, when e come dey sick, come dey see bleeding, come dey see this one problem or the other, dem come tell am say okay make e go do some particular test, then dem come find out say na cervical cancer. Now we come say okay make we quickly stage the cancer, we come find out say na stage 3 wey be say we no go fit do anything. Which of them is better? If this person have gone for screening and we find out when e dey on when e just dey in the primary state wey never even be cancer, than now when e come be cancer when dem no go even fit do anything for am again. So it is good to know your problem so that you go quick handle am than to form say you no get problem, whereas problem dey inside the body, e dey kill the person dey go. Now this one make some people dey fall for ground doyo there, doyo kpai, without knowing say they get BP. Because BP not dey show for face, e no get signs, most of the time e no get signs and symptoms. Now very few persons, those people when they say that now when they get headache, they don't say they get this. If you check their BP, most of their BP already go very high. When we say if even cause them to get stroke. Now, which of them will be better? You going to check your BP and find out that it's high and start medication on time than to say you can't go get stroke. When we say you can't go physiotherapy and everything before maybe you fit get yourself back, or sometimes you may not even get yourself back. So make we not say because you go do test or screening, you can't see some problem. It better say make you go do the screening. No. I sometimes tell some of my clients, my patients say, when find out say they be HIV positive, I say which of them they good. No say you dey HIV positive now and they treat yourself, or you not know and you dey there, the HIV they kill you, they go. Maybe before we come find out, even when we give you drug, nothing we fit do. So it good maybe they do our test. Screening test is very important.
Pedro don't answer this very, very, very important question. So I beg everybody when they hear us, it's good make you dey do screening test. Nobody say we dey pray make you sick, but when you come do your screening test and there's a problem, you go help us know on time. And even when we treat them at that early stage, you know, go dey too expensive. You understand? Very, very good. Okay, so if you get any question now, somebody they ask us question for Instagram. What's it be name? Energy01. They ask for Instagram. He say, we did live on YouTube, we did live on Facebook, we did live on Instagram. So we did take questions one after the other. So I beg, you will need to calm down. I beg. He say, which test I will tell them when I go first as a man. To make I answer your question to you. You won't go study and you be man. So when you go to hospital, those advise you, first of all, try get your doctor So that when you do this kind of test, it will fit help you analyze your results. But as a man, the kind of test wey you go do, your blood pressure dey important, your blood sugar dey important, your cholesterol dey important, your fasting lipid dey important, your liver dey important, your hepatitis screening dey important. And then if you don come reach that kind 40 years and above, 40 and above, e go good make dem also check you for prostate cancer screening. You understand? Prostate cancer. Then, if you get family member, maybe we don't get colorectal cancer before, you go need to screen. This is why it go good make you get a doctor wey know you, wey know your medical history, wey know your body, wey know your family history, wey go advise you on all the tests wey you go need to do. You understand? Also, that is if you get money, because this test sometimes then they plenty. But if you get the funds, all these tests will be done list. Like this basic test way go help you. I don't know if Dr. Israel get anything to add again.
Okay. Only way thing I go ask now be say most of the time we no wan just tell you say do this particular test. Like me now, I know fit when you come meet me say which test I go do. It's not just as your question be. It's not waiting I go want tell you. Eh? So now make when I start I said one thing I say go hospital. So what did they do for hospital? That's the thing. The hospital not be say most people. I notice one thing when some people they do when they reach hospital, mostly private hospital, they go directly to the lab and tell the lab man there say I want to do so test, I want to do so test. Now because the hospital need money, yes, they must grow. They not even want to know who send them the test. They go just run the test for them. But the right thing to do now to go meet your doctor, follow your doctor talk. Yeah, I not get problem, but I came for a routine checkup, a routine checkup. So the doctor will talk with you, ask you some questions. From those questions, one question go lead to another, go lead to another. And when you don't ask so many questions, you'll know some investigation wey e go do for you. And this investigation go follow the normal routine investigation wey no concern age. There's some investigation wey be age specific. Age specific. That is some particular age people now go when you reach some particular age, that particular test they go do one for you. So you go also do all those investigation for you based on the age when you be. So that when you don't do all these tests finish, the doctor when you first see, now go come see, then you still go give the result, make it explain what he see. Now, not be say you do test, you do test, you give doctor say you do okay, you rest. No, I think you it's your right to understand everything wey dey that test. And if you not ask the question, doctor may not answer you because he believe say you know, now make you not ask. So when you bring the results, you not understand. Abeg, ask the question and he will answer. So not really find out which test you need to do from this platform, but see the good information what you need to take. Now go hospital, let your doctor, if you not get a family physician, try get one, make it do all the, make it follow you talk, then know the different investigation we can do for.
Thank you so much, Dr. Israel. I go need to re-emphasize them because most times people won't just go do test. When you go do test and you get the result for your hand, what else? Do you understand? So if you go lab now, you go do test, and then give you the result, what are you going to do with the result? You go need to take that result to your doctor. This is why it is very important. Say before you carry out any test, see your doctor. Follow and talk. He know you pass anybody. He go come see your result, go help you analyze. Let me say you go do test finish, you come dey meet us say I do test, help me interpret my result when I am not your doctor or we are not your doctors. Do you understand? So the best thing to do is have your doctor, then speak with your doctor. When you do the test, you go carry your result, go meet your doctor. Because if you go do test, you can't dey meet doctor online. Please, oh, I do test. What is my result saying? We cannot lie you. We cannot lie you. We no go respond to that kind of question or that kind of comments. You know why? We no be your doctors. So we go beg before for any annual medical screening, always discuss with your doctor. You can have your personal doctor or your doctor in the hospital. It is very important. Okay, you understand? Very good. Okay. Um, if you get any question on medical screening, I beg, ask us right now. Hmm? Ask us. If you ask us any question, we know they related to the topic tonight. We no go respond. Hmm? We no go respond. Yes, yes, yes. Okay. Let's see. Okay. Then some people no. If you get family member, hey, let me tell you a true life story. I know somebody. The person parents get diabetes. The person grandparents, the grandparents from the father side, the grandparents from the mother side also get diabetes, and the grandparents get diabetes, meaning that this person they at risk of developing diabetes. Guess what? This person they monitor in blood sugar. This person they exercise very well. This person they work with because this person they at risk of developing diabetes. So it's good may you also know your family history and know wetin dey happen. Oh, my family, oh, then they get hypertension. Oh, my family, oh, then they get cancer. Oh, doctor, what can I do? Your doctor go come advise you on what to do. E clear abi no clear?
Yeah,
Okay,
that one na
okay.
truth. Now, even when that one na truth, even when we dey talk say there are some disease wey dey go age specific, there are still some disease wey be hereditary. That is okay, is familiar. Let's call it familiar. That is, if person parents get am or person relative get am, there's every tendency say that person fit get am. So if you know your family get such things, you really need to dey do screening based on those things as well. Now, for me, as I dey talk to you, so every year I do my eye screening. I go for eye checkup, eye screening. Now, wetin my doctor tell me make I dey do be that. So I actually do it every year. I dey screen myself for one of the eye issues. Now, not be say I get am, and I don't even know if any of my family member get am, but I know that most of my family people, for my mother side, almost all of them, some of them they wear glasses. If they get am, all of them they wear glasses, and then they use eye drop well well. So when they ask me some questions, I told them I don't know, I can't really tell, but I will find out. I ask them, even then, now they're not be doctor, they feel them in quotes, they not give me the real thing where they treat them for. So every year I go for that checkup, I just go check to be sure, say man, my ICD within that normal range. So that na still medical screening to me, and that's to my own self. That na my own medical screening. So everybody, as I earlier said, if it not be all the screening, if it not be all the tests, but it gets some specific ones when you need to dey do. As Dr. Fred don mention some of them. These are very important ones that and like they are compulsory, that you can actually do them once in every year. And also, if you dey on medication, you dey on medication wey you dey take continuously, mostly people wey get hypertension, diabetes, all these people wey get chronic diseases, HIV.
Wow, Dr. Israel, please join us back again. So Lolo said something. He said, for my family, we have the history of cholesterol, that is high cholesterol. So I started early to control my own through my doctor. Very, very, very good. Lolo, thank you so much. You see, when you pay attention to your family history, when you know what they go on for your family, it will help you. hmm, It will help you so that you will know the kind of test and how to monitor yourself together with your doctor. We dey always emphasize you need your doctor. You can't just go to the lab and do a test and then you have the results. You look the results, you don't know what to do. Hmm? That is why we go beg you for here. It's not enough for us to tell you the test. If I tell you the test now and you go do the test and there's a problem in the result, what are you going to do? You will come the run up and down. If you go and do the test and you have the result in your hand and you don't even know how to interpret the result, what do you want to do? You can't give me the result because I'm not your doctor. I will not help you interpret it. Yes. So the best thing to do is know your people, know your family, have your doctor. People they help you and guide you. Mhm. Uh-huh. Okay, let's see if there's any comments on Instagram because we are live on Facebook, we are live on YouTube, and we are live on Instagram at the same time. So wherever you do watch me and you get question, no problem. Drop your question, I will see them and I will respond to you. Um, Florence, say, good evening, Doctor Abeg. Help me repeat those tests you talk about. We don't talk. Say it's not enough to tell you the test. Do you have a doctor? Before you go do any test, it's important to discuss with your doctor first. Because now you know medical history. Now you know you. You understand? The way you do the test, it go help you interpret the result or tell you there's no problem or there's a problem. Because if I tell you go and do um lipid profile and there's a problem in your lipid profile, what you want to do, you know go know why your check you get. So the emphasis of today's discussion is not to come online and tell you say everybody or you are wrong go do test. Do you have anybody to help you interpret it? If you don't have, you wasted your money. And we don't want to make you your money online. You understand? Don't leave them before. Dr. Israel mentioned the test. We spoke about your blood pressure. We spoke about your blood sugar. We spoke about your fasting lipid profile, cholesterol, your liver function test, your kidney function test, your electrolyte creatinine. We spoke about if you're a woman, you can check for breast cancer, cervical cancer screening, and the rest. Then plenty. But if you don't get a special medical condition, you don't go there. Do this one, and there's one that you need to do that will not do you well. It makes sense. And actually, you get to talk about, and we know one list for you make make you improve. Good. So let me see if we get question or okay, and don't go get question. So make we continue. Doctor, please continue.
Okay.
Oh, your
May I
network don't cease again. Sorry, your network been seized. Okay, okay, okay. Ma bring Dr. Israel. Sorry. It says yes, I have a doctor, a very good one. Okay, nice, nice, nice. Okay,
Yeah, if
you are
you
back.
get doctor,
Go
a very
ahead.
good one, maybe meet the doctor. Now the doctor will tell her all the tests we need to do. Okay. As I was saying, what time they talk? Dr. Fred, you dey hear me?
Yes, yes.
Okay. What time they talk? I say if you can't be say you take drug for some particular disease, some particular conditions like hypertension, diabetes, chronic conditions, HIV and all the rest. It good make you they do some specific some screening
Yes.
because this disease state where we say they take drug for you know say all every medicine get their side effect and this drug can affect any part of the body eh, based on their mechanism of action how they take they work. So because of that your doctor will always they tell you the test when you need to do based on the disease state when you get some of those tests and those can also be part of your screening test because of the drug or because of the things or because of the disease wey you even still get. Like for hypertension now, the doctor fit dey even tell you make you do make you do ECG to check your heart, make you do kidney test to check your kidney, and so on and so forth. Now, I just use that one as an example. I think that's the only example I would like to give. So it just dey like that. So some chronic disease state when you dey take drug because drug medicine na no be na poison before e become medicine. When you take am for the correct dose, you come become medicine. So e fit cause anything for person body if you dey take am continuously. However, na make the good the use of the doing na make it good make you dey do all this your screening test, so that as you dey do the test, when the doctor don notice say this particular drug wey this person dey take, if e dey cause this, e go change the drug and give you another one wey no go give you problem. So that one na say another set of persons wey need to dey do their screening always, even though we say everybody suppose do screening. So for this set of people, even better say you do it more than the annual screening when we even talk.
Thank you so much, Dr. Israel. I beg, help us share this video so that more people go here. If you get any question for us, please ask us your question. This program, we get few more minutes and then we go day over. This program now every Sunday by 8 p.m. with African time. And here, we day here to teach you to make them as simple as ABC for you. We always tell people, say, this platform no be hospital. We know they treat anybody. We just be here to teach. You understand? But if you get any question which relating this topic, I beg, drop them in the comment section, so that we go respond to you. Oluchi Barracks, God bless you. God bless you. Thank you for watching. Yes. For the very first time, make I announce again, for the very first time, we are able to stream on YouTube, on Facebook, and Instagram at the same time. So anybody where they watch us on YouTube, they see the same thing where people where they Instagram, they see. And this thing, thank God, so we keep one. So we try and make this information accessible to everybody. So do well to support us by inviting people. Those with the Instagram, if you get any question for us, I beg, drop your question. I can see you. Yes. Okay, which other thing again about medical screening? So for those who they like Nigeria, I beg, we get good doctors. I'm not talking about those who they are abroad. Those who they are abroad, they have a very good system. But those within Nigeria, we get good doctors, we get good hospitals. Please meet with your doctor, follow and talk. No fear. After you do the test, anything we no come to you, ask him. Now your body, no talk say because I go hospital to see the doctor, I dey fear to ask him question for waiting. Why you go dey fear? No fear. He go answer you, he go break them down for you, he go explain them to you. Very, very important. Let's see if I have a question here. Hello, this is really good. I like Instagram. Okay, the only thing is that I might not see your comments on Instagram right here. Okay. Okay, somebody drop a comment here. Ben Juliet says, I already asked my doctor last week for my next general screening. My appointment is next month, but it's always doing mine every 3 years. No problem. Now your doctor know why until you every 3 years. You get. I don't know why you. I don't know. I don't think Dr. Israel get anything to add to
that. And we say something. You get some of the cases where we say it may not be every year. And we talk and say get some of the disease cases where we say not be every year that they do. And I use cervical cancer as a case study. Say that one every 2 years. Every 2 years now the person they do the test. So sometimes some doctor can also decide, so, okay, and because this person has been normal, has been within the same range for a very long time, they can extend the years where the person will come do this different checkup. Now, when they talk about annual screening go across every part of your body from your head to your toe. It simply means say having just one doctor may not be enough, because that one doctor not go fit do your annual screening for your eyes. That one doctor fit not be able to do annual screening for your throat and ENT. So that same one doctor fit not dey just like that. So it simply means say sometimes you may have multiple doctors. For the women, your gynecological cases, general doctor fit not get more knowledge about it. So you need a gynecology for those kind of cases. So it means saying sometimes one person fit get like 3 or 4 doctors when they use for a annual screening, and these people will give you different appointments. So their different appointment fit come make you dey get some appointment for 3 years based on the condition when that person they do the screening, they do your screening for. Yeah, and also apart from that, there are still some screening when you feel they do, as we said, when you feel they do less than that. All those simple, all those other simple one when you be say you feel never need to use money to do. Yes, you feel need to do them as early as you can. So I go see for those of us who are in Nigeria, we know say yes, financial thing get it make things not too easy for us. So because of that, you can do some specific uh, 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 screening tests. You may not want to do all the tests, but you just based on your age, based on your family history, you want to do some particular one. And as Dr. Fair talk, I bet not go do test, then come dey find doctor when you give. So I mean you not waste your money, because sometimes you fit do that thing finish. And then you give the doctor, he go tell you make you go do the one wey he think say be the right one for you. By then you would have wasted some of your money. That same money wey you will say will not get.
Thank you so much, Dr. Israel. Um, Florence, Florence, they talk something. Florence, say, doctor, what if you don't get any sign of any sickness? Can you still go to hospital for checkup? The answer na capital yes. So because the whole emphasis, the whole reason why we dey talk screening na say sometimes you fit no get any sign for your body, sickness fit dey. That is number one. Number two, if you can't go do the screening and there is no problem, you are still okay. It's fine. But wetin go dey bad be say make you can't wait, make sickness come dey the body. That one no be screening anymore. Do you understand? Screening na say we dey pick am before e show any sign. That is why we call it screening. So you don't need to wait, say abeg o, why I go dey go hospital when I no get sickness. You might not even know, say something dey inside the body, dey spoil the body small, 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 small. And that screening again for the eyes. Some people dey dem get eye problem. Example of eye problem like glaucoma, they no go know. E no go show them sign. The eye go dey get problem small small, they no go know. One day, you go just hear say somebody don blind. They go think say na village people. No be village people o. Na because the problem don dey for the eye since the person no pay at ten tion, the person no know. Do you understand? This is why we talk say at least annually, once in a year, you just go and check. And if you check and there is no problem, fine, you're happy, you're home. But if you can't check and they come pick and say something dey your body, at that very early stage, e go dey easy to treat am, e no go dey expensive. You understand? That is the whole essence of medical screening. Why we dey beg, abeg, make we go, because it is cheaper, it is less expensive, it is less stressful for the patient. It's even easier to manage for the medical team. You understand, abi? Okay, any more question? Abeg ask us, because we go soon round up this session tonight. Let's see if we get a comment for Instagram. So those with the Instagram, abeg drop your question. I go see them and I go take them. I see you, Okoya. I see you, Stella. I see you, Alex, Auto Care Services. I see you. Welcome. Okay, Oluchi dey ask us question on Instagram. He say, but doctor, sometimes if you are very fine and you go to hospital and tell doctor about checkup, he will see you as person wey get time and want to waste money. Dr. Israel, respond to this person.
Okay. Yeah. You know, now the setting where we did for this country now make am be like that. I said this thing. I say most of the time na as Nigeria be, now they cause all those things. They're not to really get that screening or that medical checkup. How will I put it? They're not to get that. I don't know how to talk about. They're not the too let go for those checkup. So because people not the too let go, Doctor don see am say na strange thing for anybody to even walk in say na checkup e come for. E look strange to the doctor, and because doctor just dey wait say na disease state, na disease state, na disease state na im wan come see, na e come for. Yeah, that's the reason why e dey.
Okay, make I continue from where Dr. Ilias stop. Wetin dey try talk be say because of the kind of environment wey we dey and most times people no dey come hospital talk say I wan do screening. Na only when dem sick in most cases. So we dey try form this habit because prevention is better than cure. And especially when healthcare don come dey quite very expensive. Wey be say when you sick now to treat yourself, e fit suck all your money. So we dey try start this new habit to dey teach our people. So when you go see your doctor and he tell you say why, abeg, carry your body comot for there, go see another doctor. Go see am make e check you because you don get information. So the doctor na people wey dey see na im dey see well well. So im never see people just talk say I wan come and do screening. Shey you get? That is why if you go do am and the doctor no answer you no follow am drag, no follow am argue or fight, carry your body go see another doctor abeg, make e screening for you, make e do your test for you. You carry your result go give am, go help you analyze your result. Shey you get? Na im be the thing. Yes, thanks a lot. Okay, Oluchi, yes, thank you for your question. Yeah. So if you get question for us on medical screening, abeg, ask us. If you ask a question wey no dey related to this topic, we no go answer you. We dey talk about medical screening. We don tell you the type of medical screening, why you need to go for medical screening. You must have your doctor. No be say you go just go do test, you come dey call me, doctor, I have done test, help me. No, I no be your doctor. I no go fit help you. Well, before you do test, see your doctor first. He know you. He go come tell you. When you do am, carry your result go meet am. If you go meet your doctor and he no gree do test for you, abeg, go find another doctor wey go check you. We no wan make people dey fall sick. If you fall sick, we go treat you o. But right now, we dey preach prevention. Prevention is better than what? Better than cure. Any final words around?
Okay. As Dr. Fred just talk, prevention is better than cure, and screening is all about prevention because we just want to prevent any disease state when fit come up. But if the disease state come dey there, we go just treat am before e come lead to something else. So I wan encourage us, make we try. For those wey no dey go for medical screening, make we try dey go at least once a year. Or if you think say once a year even too much, but just try go. I think if you start am, you go see the benefit of going for medical checkup. And also I go also remind us say this one na festive period. There are so many things wey go dey happen this period. Please take care of one, your mental health. Not say person get pass you can't go dey think too much. No. So take care of your mental health. And the weather is also very hot. Try to drink a lot of fluid so that we all go dey all right. So that after this festive period, we go we still know say yes, we not use this festive period to cause problem for ourselves. We not take una for granted all the time when una take dey follow us, they stay here. All the time when you take dey follow us, they stay here, they listen to us. We not take you for granted. So always remember, say we like una well well, and we will keep on giving you the best based on our wetin we get and based on our knowledge. We always give you the best.
Thank you. I can remember when I just gave birth, I took my child to pediatric hospital for checkup. examination. The doctor told me to take my child back, that there is nothing wrong with him, without checking or running tests on him until I insist. Thank you, Lawrence, for sharing this comment. I don't know why the doctor refused, but thank God they still check your child for you. If they check and there is no problem, there's no problem. Fine. You take your child home. So thank you, everybody. Just like Dr. Israel talk. Thank you for watching. Those who watch us on YouTube, those who watch us on Facebook, and those who they watch us right now on Instagram. Thank you so much. Right to my private community. Oh. You can subscribe there. I will do private live session. I can speak with you directly one on one on the live platform. That one is special. If you want to subscribe, look for the link and subscribe. But here, we don't take it for granted. I appreciate you for your time. God bless you for spending your data on our page. Thank you for sharing to your friends. Thank you for commenting. God bless you. We will meet here again by the grace of God on Sunday by 8 p.m. West African time. No come late on Sunday 8 p.m. During the week, you can catch me on my private channel. I might not be coming online on this platform like before again because of one or two stuff. But in my private channel, I do come online there for some special people. If you want to join them, please click on the link, subscribe, and then I will speak with you. I always tell you, good life now waiting. Life, good life now. God bless. Take care of yourself and have a wonderful time. Bye bye.